Hold up, did you just say my spine can be affecting my bladder?
Yes, absolutely. Let me tell you how. A lot of people don't realize that a spine issue can cause bladder issues, and these will get misdiagnosed as interstitial cystitis, overactive bladder, or bladder pain syndrome. Let me show you how. The lower aspect of your thoracic spine and the upper area of your lumbar spine actually send a nerve signal to your bladder. And when there's a problem here, which there often is, that nerve signal is causing issues at your bladder. And now you're going all the time, you're not voiding properly, maybe you're even getting pain in this area, and it often gets misdiagnosed because your spine, specifically at this level, rarely gets looked at. And here are some signs that it's your spine and not your bladder. If your symptoms came on after back pain, if you've had a history of back pain, then it's very likely a spine issue and not a bladder issue. If your symptoms are positional dependent, if you notice that if you're in a car bouncing up and down, or if you're doing a certain activity like walking or running and your symptoms are worse, then it's very likely a spine issue, not a bladder issue. If you have symptoms of pain, numbness, or tingling outside of where your bladder is, then it's not a bladder issue. A lot of people have a history of back pain or an accident, and this can be anything from trauma like a car accident or a fall, or it can be from stuff like carrying a baby or playing sports. A lot of people that hyperextended their back actually get a problem in this area. And finally, if you're doing all the stuff that they tell you to do to fix your bladder, like you're having a bladder diary, you're limiting caffeine, you're drinking the appropriate amount of water, and you're not doing all the other irritants, and you've done all the pelvic floor treatments and you're still not getting better, well then maybe it's your spine, and that's the actual underlying cause. So instead of conceding to lifelong symptoms that don't have a treatment, maybe get your spine looked at because there's very likely a fix.